this is the part two of the ongoing series on cerebral circulation. In the last part, we talked about internal carotid artery, right from its origin to its very end. In this part, we'll talk about great arterial anastomotic ring, which is present around the basal brain structures, that is the circle of Willis. Circle of Willis is very important because it helps in connecting the anterior circulation from the posterior circulation, and in the case of an unfortunate event of arterial occlusion, circle of Willis is a source of potential collateral blood flow to the occluded territory. If we talk about the normal anatomy of the circle of Willis, these are the two internal carotid arteries, the right as well as the left. This is the anterior cerebral artery, and this is the communication present between the right as well as the left anterior cerebral artery, the anterior communicating arteries, and the very important posterior circulation, the vertebral arteries, which are joined together to form the basilar artery and the terminal branches of the basilar artery, the posterior cerebral artery, and we also know that the C7 part of the internal cerebral artery gives us a communicating branch, the posterior communicating branch, which is very important because it helps in communicating the anterior circulation from the posterior circulation. And so basically, the circle of Willis has 10 segments. This is the ACA, bilateral ACA. This is the anterior communicating artery. This is the basilar artery and its terminal branches, the PCA and the communicating arteries, the posterior communicating arteries, and obviously the internal carotid arteries. What we have to essentially remember is that about circle of Willis, circle of Willis, variation occurring in the circle of Willis is a rule and not an exception. They are very common. For example, if you take 100 random people and that 33 of them will have variations in their posterior cerebral artery. It can be hypoplastic, it can be absent altogether, and in at least 15 of them we can see changes in the anterior cerebral artery. It can be duplicated, it can be absent, it can be multi-channeled. So what we have to remember is that variation in circular Willis is common, because of which it can cause significant flow asymmetries, and we should be careful to not interpret them as vascular diseases. So let's start a discussion from middle cerebral artery, which is not part of the circle of Willis. Basically, it has four segments. Before discussing the middle cerebral artery, let's do a very brief recap of the part one. So this is the ascending aorta, the descending aorta. If we scroll more cranially, this is the arch of the aorta, the three branches of the arch of the aorta, the brachiocephalic trunk, the common carotid, the left subclavian artery, and if we continue tracing the brachiocephalic artery cranially, we can see dividing into the common carotid as well as the right subclavian artery. The common carotid artery can be seen dividing into anteromedial ECA and the posterolateral ICA, which is present just medial to IJV. If we trace the internal carotid artery more cranially, we can see it entering into the carotid canal, the C2 part, which is the Peters part of the ICA, Peters segment of the ICA. This is the foramen lacerum, which the ICA enters to become the C3 part. This is the cavernous part. Then it becomes the C5 and the C6, the ophthalmic part, which is giving the ophthalmic artery in this section. Then it ends by becoming the communicating segment of the ICA. And in this section, we can see the ICA giving the middle cerebral artery. Middle cerebral artery has four segments. The first segment, the M1 segment, which can be seen in this axial CT angio section, we can see that it is going horizontally, laterally. Therefore, M1 segment is called as the horizontal segment. This one horizontal segment goes laterally till it enters into the sylvian fissure, that is the lateral cerebral fissure. But just before entering into the sylvian fissure, it bifurcates or sometimes trifurcates. In this section, we can see that the MCA is bifurcating. The MCA is seen bifurcating, and as we all know, the middle cerebral artery base mainly supplies the lateral surface of the brain. The M1 also supply the M1. So obviously it gives us two branches. One is the lateral lenticulostriate arteries, which basically supplies the all the lateral structures of the basal ganglia, the lateral putamen, the caudate nucleus, the external capsule. It also gives us the temporal artery, the anterior temporal artery, which mainly supplies the tip of the temporal lobe. The M1 part, um, after entering into the sylvian fissure, it enters into the insula of the brain, therefore also called as the insular part. The sylvian fissure can actually be better seen in the coronal view. So if you open the coronal view, we can see this is the internal carotid artery, which can be seen giving the middle cerebral artery. This is the M1 segment, which is going horizontal laterally, and this M1 segment enters into the sylvian fissure, um, and then it enters into the insula, which is the M2 part of the obviously the middle cerebral artery. Then at the top of the sylvian fissure, the MCA branches loop over that area, then courses laterally under the opercula, which is like parts of the frontal, parietal, and temporal lobes, which is present over the junction of the sylvian fissure. So this part is the short part is mainly the M3 part, which is the part, opercular segment. And from the M3 part, we can see that the middle cerebral artery continues and supplies all the cortical structures over here on over all these areas. So this part is called as a cortical segment, which exits the sylvian fissure and ramifies over the lateral surface of the cerebral hemispheres. What you have to remember is that the info part shows a considerable amount of variations in each individual, but this is the middle cerebral artery. As we all know, the vascular territory of the middle cerebral artery mainly supplies the lateral surface of the cerebral hemisphere, with the exception of a thin strip at the vertex, which is mainly supplied by the anterior cerebral artery. So this is end of the part 2. Let's continue our discussion on cerebral circulation in the next part. Thank you.